Good day, everyone. My name is Chidinma Opoko. I'm a technical officer with the WHO Regional Office for Africa, and I'll be speaking on addressing NCD risk factors. First of all, I'd like to thank the organizers of this event, Engage Africa Foundation, for the opportunity to speak. Here is my outline, introduction, the burden, the response of WHO, country examples, challenges, opportunities, and way forward. But first of all, what is a risk factor? Risk factor is an aspect of personal behavior or lifestyle. It could be an environmental exposure. It could be a hereditary characteristics that is associated with an increase in the occurrence of a particular disease or health condition. So you could have risk factors for diabetes, you could have risk factors for cancer. Now, risk factors could be modifiable or non-modifiable. Modifiable risk factors are risk factors that you can do something about. And they're either behavioral or metabolic. For behavioral risk factors, they include tobacco use, alcohol use, unhealthy diets, which are diets that are high in fat, sugars, and salt, and physical inactivity. While metabolic risk factors are elevated blood pressure, elevated glucose, raised total cholesterol, overweight, and obesity. And then non-modifiable risk factors include age, gender, race, and family history. Now, I want to talk a bit about the burden of NCDs. Now, there are 4 major NCDs. NCDs are non-communicable diseases, and they include cardiovascular diseases, cancers, chronic obstructive pulmonary diseases, and diabetes. Now, NCDs are responsible for about 74% of all deaths globally. So 3 in 4 deaths globally are due to NCDs, and they are the first cause of death and disability worldwide. Now, there are 4 major risk factors that are associated with these NCDs, and they include tobacco use, the harmful use of alcohol, unhealthy diets, physical inactivity, which are the behavioral risk factors that I had mentioned earlier. Now, I want to talk a bit about the burden of these NCD risk factors in the African region. Now, the average prevalence of tobacco use among adults who are age 15 and above in the region is about 13%. And among adolescents, it's about 10%. However, there are over 61 million smokers in the African region. This is high. And the use of tobacco is more in men compared to women. Now, over the harmful use of alcohol, it's also more in men compared to women. And as a result, we see more men die compared to women due to use of alcohol at the rate of 4-1. Now, the consumption is on average is 4.83, but it varies from region to region or country to country. You could see in countries like Tanzania, it's really high, or in other countries like Algeria, it's low. Now, when we come to physical inactivity, this is where we see a reverse of the trend. Here, it's actually higher in women compared to men. And even though the prevalence of physical inactivity in that region was estimated at 22%, we see a quadrupling of the rate among in-school adolescents aged 11 to 17 years, which brings it to about 85%. Now, for unhealthy diets and overweight, the prevalence of overweight is about 31%. And as we saw in physical inactivity, it's higher in women compared to men. And then it results in loss of life and disability. Now, what is WHO doing regarding all of this? We develop technical packages which are to help countries and all civil society organizations reduce the burden of these risk factors. So to combat tobacco use, we have the Empower technical package, which has to do with monitoring tobacco use and prevention policies to protect people from tobacco smoke, offer people help to quit, warn about the dangers of tobacco, and enforce bans on tobacco advertising, promotion, and sponsorship, and finally, raise taxes on tobacco. However, for alcohol, we have the safer technical package, which has to strengthen restrictions on alcohol availability, advance and enforce drink driving countermeasures, facilitate access to screening, brief interventions and treatments, enforce bans or comprehensive restrictions on advertising, sponsorship, and promotion, and finally raise taxes on alcohol through excise taxes and other pricing policies. There are similarities between the technical packages for alcohol and tobacco, and even in the burden, there's some similarities. Now, we're concerned about making this product very unaffordable. Hence, we want to increase their prices. That's why we raise taxes on them, and we also use other pricing policies in addition to tax. Secondly, we want to reduce the exposure of people, adolescents, children. So advertisements involving tobacco and alcohol, because research has shown that when children see these images, they are more likely to indulge in this behavioral things. They're more likely to use alcohol or use tobacco. But we're not just concerned about prevention, even for people that have that are using tobacco or using alcohol and want to stop. We're also there for them. So we offer help to quit tobacco use, and then we offer access to screening, brief intervention, and also treatment. Now, with regards to unhealthy diets, we're focused on salt consumption and fat consumption. So to reduce salt intake, we have the shake technical package, which means is to shake and reduce your salt intake, and then we have the replace for trans fats. Now, shake has to do with surveillance, harness industry to promote reformulation of foods, adopt standards. You need to know the knowledge. In that pastry you had this morning, what's the level of salt in it? In that cookie you had yesterday, or that snack you had, what was the level? Do you know the quantity of salt you're consuming on a daily basis? And also to change the environment. Now, for replace, we have to review, promote, legislate, act, assess, create, and enforce. Now, for the active technical package, is about reducing physical inactivity and increasing physical activity. So we need to be active. So it's about active societies, active environments, active people, and active systems. So it's not a siloed thing. It's a multi-sectoral thing. Then, in addition to technical packages, we also have data systems. We have information data banks, and then we also develop guidelines and documents to put people with the latest knowledge regarding these NCD risk factors and keep everybody informed. And while we have global documents, we also have documents developed by us in the African region, for us in the African region. But how do we how does this translate in country? So we help countries to develop policies. It could be policies and legislation. It could be an alcohol control policy. It could be a physical activity guideline. It could be nutrition guidelines. It could be tobacco bill. We also support taxation activities. We want taxation, it's a win because we increase the tax for this product. It makes it less affordable, so less people consume it. And then the government has more money to use this tax to better the health of the populace. And we've seen countries use this tax to build, for example, a tobacco cessation building system to not only help people to stop tobacco consumption, but also guide them through the process and offer help and support to them and their families. We also have information systems. We use the STEP survey to collect data. And then we also have webinars and other events where we share information and best practices. We bring a lot of people together. We recently had a webinar where we invited all the countries in the African region to share experience with regards to physical inactivity and physical activity and walking and cycling. Then we organize forums for member states to review global and regional documents. So we don't just make those documents, we don't sit in our offices and make the documents alone. No, we seek help from our partners, and then we seek their input because we value those inputs. Then we also develop advocacy tools like the HEAT, which is the Health Economic Assessment Tool, which helps to show the value of walking and cycling. It shows if you put in this amount, this is how much we would get. It's a good advocacy tool. And we also develop advocacy briefs and investment cases for mental health, alcohol, tobacco. So you know that there's a good return, that reducing non-communicable diseases risk factors is a good return on investment, because for every amount you put in, you get way more than you put in. Now, I just want to give a few country examples. We have the Meximex in Capo Verde, which was about physical activity. The country came together with the support of WHO at various levels and also with community organizations in the country to come up with this plan, a national program to reduce physical activity. And then on the other side, we have the national alcohol policy in Sierra Leone. It was not just a country effort. It was the country, various ministries in the country with the Ministry of Finance, Ministry of Justice, Ministry of Health, various CSOs, including West African Alcohol Policy Alliance and the Sierra Leone Alcohol Policy Alliance, and a lot of CSOs were involved. So we say in Africa that it takes a village to raise a child. Well, when it comes to NCD risk factors, it takes a village and even more, because we don't want siloed approach, and we want to give everybody a voice. We give everybody a voice because we know that everybody has something to bring to the table. So we give everybody a voice and we hear from everybody, and then it makes the things that we produce richer and something that everybody has. It makes everybody stakeholders, and then because we all contribute to these programs, there's a sense of shared ownership, which makes it more efficient in the long run. Now, what are the challenges? There are a lot. Despite our efforts, we still have a lot of countries that don't have policies. And then there are issues with policies being implemented, policies failing to pass through reviews at the level of the ministry or at the level of Senate. And then they have inadequate human resources. And then we also have interference from the tobacco industry, the alcohol industry, the sugar sweetened beverages industry. And then we have a problem of integration, as in some countries, it's not everybody is operating in a siloed approach. And that means that we're not leveraging on the expertise of others, and we also fail to, or when this happens, we fail to see the bigger picture, and most of our plans are short-lived. Then we also have an issue with prioritization. Some countries do not prioritize NCD risk factors, and as a result, do not allocate resources to NCD risk factors. However, despite all of this, there are opportunities. Collaborate with partners, stakeholders to leverage on skills, expertise, and other resources. We also use high-level political UN commitments such as the World Health Assembly and the Regional Committee to speak about, to bring the issue of SDG risk factors to the forefront so that member states are aware and can take decisive actions at those events. Now, what is the way forward? We need leadership and political commitment. This is very key. It is very, very key. Despite the political instability across the region, we need this. This is key because when we have this and there's a direct order from the top level of government, things move faster. We also need multi-sectoral partnership and coordination. It's not just the Ministry of Health. Health is no longer domiciled just as the Ministry of Health. If it's an issue with physical activity, it's not just the Ministry of Health. You're going to involve Ministry of Urban Planning, Ministry of Transport, Ministry of Education, Ministry of Justice. If it's something that has to do with a healthy diet, you will need the Ministry of Agriculture. So it's not just a Ministry of Health approach, it's a whole of government. Then we also need policy alignment. What this means is that the policy, for example, for tobacco should not go against the policy for alcohol use. There has to be policy coherence. There has to be policy coherence and also advocacy. We take for granted that a lot of people know, but the truth is most people do not know. So we need to advocate both to decision makers and the people affected by those decisions. And we also need resource mobilization. We need community engagement. And finally, we need monitoring framework. All this work that is being done has to be documented and has to be monitored over time. So we see, oh, since we started this work, this has happened. If this has happened and it is not what we expected, we need to course correct. All of this would result in the burden of NCDs and NCD risk factors going low, and also the African region being very, very healthy. Thank you so much for listening.